Hello everyone, I'm Michael Hoxson from HoxsonHealth.com, and today I'd like to share a video with you based on a case study of a client that I just had a session with a couple of hours ago today. And I call this case study the case of the insidious chest pain. This is a client, he's a young male, early 30s, who had complaints of chest pain for about a month or two, and the onset of the pain would come about no specific patterns that he could distinguish, where it would arise during subtle movements such as swinging his arms while he was walking or while he's reading, basically relatively little activity, as well as with his other athletic activities such as mixed martial arts training. Now, this young gentleman had seen a cardiologist and did a typical cardiac workup, EKGs, echocardiograms, etc. Everything came out negative. Doctors decided it was just basically a muscle strain. This individual is pretty connected or aware of his spiritual self, so these issues that arise as a result of the physical pain that he became aware of, and I had initially discussed that with him. To make a long story short, in that aspect, he was doing too many activities in his life, possibly out of ego aggrandizement or just satisfying his ego, and he's also experiencing the death of his father earlier this year. So it was a culmination of life situations that spiritually or energetically were manifesting as this pain in the heart, pain in the chest type of pain. And it was really described as like a sudden, sharp, stabbing, strain, cramping, like having a heart attack, a mild heart attack type of pain. So conventional medicine wasn't really sure what it was, did all the workups, left it as a strain. He intuitively knew it was something spiritual, but also he felt that there was something structurally going on. So being the nature of my practice, where I take the whole individual, look at the whole person, physical, mental, emotional, as well as spiritual, and put it all together in a complete picture, or more of a complete picture, to help the individual. And what I saw from purely a physical viewpoint, alongside some energetic, subtle energies as I call it, when I saw him today and assessed him in this aspect, was he came in today, totally addressed all the life situation stuff as far as cutting down on his activities, actually abstaining from all his physical athletic training, so to speak, and being more conscious or aware of when these symptoms do arise, which are just very sporadic. So today it came, and just energetically I was able to track or assess that he had some type of heavy energy around his chest, more biased towards the left side, head and chest area actually, and there's kind of like a little root or little cords connected down to some heavy energy around his left knee, which is interesting because he has a history of having some kind of knee injuries and discomforts and instabilities, etc., which he currently wasn't actually complaining of. And also posteriorly behind him, there was a sense, a feeling of deficiency of energy. You have to understand energy, when you're assessing somebody's subtle energies, energy comes outward, and you want to find out which energy center they may be working excessively, or maybe working not enough, so to speak, too much or too little. So that's subtle energy-wise, that's what I assessed. And then physically or structurally, from a manual therapy perspective, his T2 vertebrae, second thoracic vertebrae, was fixated or rotated to the left. That just means in manual therapy terms or chiropractic terms, it was subluxated. It was out of place, so to speak, disturbing the function of the vertebral spine, vertebral unit, so to speak, around that area, and everything else compensates around that subluxation. So I did some other assessment. It had some connection to his pain, his chest pain. Now, he didn't have the chest pain initially, but when I had him do some provocating movements, such as extending his thoracic spine, lying supine on a Swiss ball, and fully flexing his arm to stretch out the pectoral area, right away it came out, and he felt this sharp stabbing sensation of pain, which he quickly had to guard himself. So there was some degree of fear and hesitation in his movements. And right after that trigger, that's when I started doing the assessments. So this is why when you get these things right in front of you, you're able to assess it more accurately, so to speak, because it's fresh before you. So anyway, T2 rotated to the left, okay, and his third rib was anteriorly translated, or anteriorly located on the sternum, okay, compared to the other ribs on his left side. So his third rib was protruding forward, and that makes sense because his T3, his third thoracic vertebrae, which is underneath T2, as I already mentioned, was rotated left. T3, relative to T2, was rotated right, but more so creating a rib dysfunction because the ribs attached to not just the sternum anteriorly, but also to the vertebrae posteriorly. So here you have a very obvious relationship structurally and just from a purely physical standpoint, where the client complaining of insidious chest pains that no one could figure out where or how or why they were coming about. Now, when a joint is subluxed, so to speak, the muscles that overlie those joints, because there's a change in their length-tension relationships, or there's just a change in their length of their where they're attached and inserted, that affects their function. So theoretically, the muscles in a shortened position, they're more facilitated, they're more amped to be activated or contracted. So thus the simple insidious cramping or pain-like, spasming-like sensations, symptoms that he was experiencing. So just from a purely physical matter, materialistic viewpoint, structural, he had that going on, where T3 vertebrae rotated right, third rib rotated, T2 rotated left, third rib rotated to the right, contributing possibly to the chest pain, okay? So after I did the manual therapy, manipulated T2, manipulated it back into a more neutral position, and mobilized the third rib more posteriorly, retested and reassessed his energies, subtle energies around him. So he no longer had this congestion of energy around his chest and head region. That energy was more coming outward, kind of like a spring, a misty spring of energy just coming outward more naturally, so to speak. But he wasn't out of the woodwork just yet, because what I also sensed was that he had some heavy energies around his gut, particularly around the right lower quadrant, around the gut, the ascending colon and the liver gallbladder area. And that had a more distinct relationship or root or connection to his left knee. So here we have a case where the initial symptoms